Hi, my name is Ariana Carrillo. This is for Pharmacology Module 4, Aspen University. My professor is Vanessa Segrua, and the date is Monday, December 23rd. I will be creating a 6 to 7 minute video discussing both parts of the assignment for the critical thinking questions as well as the research questions. So for the first critical thinking question, what was your first impressions of this patient's actions and appearance? What do you think she is suffering from? And I wrote that she is suffering from mental illness. Just based on the real world scenario, I believe she has a mental disorder because of she was disoriented, combative, accused the emergency medical services of stealing her purse as well. So because she was accusing them of stealing her purse, she's obviously delusional, hallucinations. She must be suffering from specifically a mental illness of schizophrenia. Also, signs and symptoms that are included in mental illness are they affect your emotional reasoning and behavior. So her combative, disoriented, those are all symptoms of mental illness. Also, the delusional part that she accused the emergency medical services of stealing her purse. And the other suspicion that I have that the 54-year-old female patient is suffering from would be substance abuse. And a lot of times in my research that I found, a lot of times people who suffer from mental illness, they always turn to substance abuse for their treatment, to just deal with the disorder. But if she just has substance abuse, well, she was combative, and all of those brain mechanisms make you become aggression. They make you become aggressive. Substance abuse makes you become aggressive, and she was just talking nonsense, so she must have been high on something. Also, to add to the mental illness, her clothing was dirty and it smelled of stale body odor and urine. So mental illness is linked to poor hygiene. A lot of times, people who suffer from mental illness have to have a family member, a loved one, a caretaker, remind them to even simply brush their teeth. It affects their emotion, day-to-day life, relationships. It's the number one mental disorder, and substance abuse is their mental illness and substance abuse are disorders, and they are the leading cause of disability. So maybe she smelled that way because she's homeless, or a lot of, and another reason why I think she suffers from substance abuse is because she demanded the doctor or the nurse to give her um, a drug bottle or alcohol bottle as well. And for the second question, for the second critical thinking, what short and long-term risk health would I suspect that the patient would face? And I put that the 50-year-old patient will face short and long terms, but I think the short-term risk are that the hygiene, um, malnutrition due to the inadequate proper food, the risk of urinary tract infections, that she's peeing on herself and she had smelly odor, so maybe she's not showering, skin infections due to wandering, because the person who called 911 was a jogger who saw her wandering a park. But some long-term effects include worsening of health, mental health, unhappiness in life, family conflicts, inability to form relationships, social isolation, problems with substance abuse, like I said previously, problems with work, since she can't fully function, she's gonna have complications of keeping a job or even getting a job, legal problems, financial, homelessness, self-harm to herself and to others, as well, like when she was yelling at the jogger, the bystander, just yelling obscenities at her. That was for the long term. And then the third question is why do you think the patient's hands are shaky, and what do you think causes her confusion about and combativeness? So I think her hands were shaking either from substance abuse withdrawal, or she was on drugs at the time, either, or if she's mental illness, then she can, had a loss of energy because she fell and she was yelling obscenities at the ladies. She's weak, like she feels weak. Substance abuse again, or lack of food affecting her musculoskeletal system. Sorry. And I believe it causes her mental illness causes you to be confused, disoriented. It reduces your ability to concentrate. So I think that's what happened to her. So the combativeness can be related to substance abuse. Drugs and alcohol may act on a brain mechanisms that trigger aggression, combative, and violent behavior. I believe the assessments needed for this specific patient are for first, diagnosis by a mental health professional, whether it be a psychiatric professional, a nurse, or anything like that, just a mental health professional. And what else is needed? Maybe physical examination, mental examination, laboratory tests, random urine tests, renal function tests, liver tests, and an x-ray, because she did fall and hit her head. Also, this is the second part of the assignment, is a research question. And mental illness management includes both pharmacological and other therapeutic methods for this treatment. Summarize how it is managed. And then according to both methods are successful according to the Mental Health Care Act that I used a scholarly article from. They issue the coverage for patients suffering with any mental disorder. This includes the diagnosis and treatment provided to the patients. And then according to the stats and the insurance plans for patient studies, mental disorder management is adequate. So to answer, is it sufficient? Yes, I think it is sufficient. I also think that a lot of people, like we need more nurses in the psychiatric, mental illness nurses, psychiatric nurses. We are in demand for that. There is a shortage for that just because you're dealing with a lot. And then my conclusion, I just wrapped it up, and I just believe that she suffers from mental illness or substance abuse. Thank you.